One of the most important conversations regarding breast cancer care is reconstructive surgery. However, it also happens to be one of the least discussed. Dr. Sybil Val, board-certified plastic and reconstructive surgeon and founder of Val Plastic Surgery, is fighting to change this narrative. Today, Dr. Val is joining UrbanMD to share 3 options to consider when contemplating reconstructive surgery.
The diagnosis of breast cancer is a devastating one. When patients get to my office, they've usually had a series of mammograms, MRIs, biopsies, and have been told that they have breast cancer. They have already been told that they either require a lumpectomy or a mastectomy, and they're coming to me to learn about their reconstructive options. It's really important that once a patient has a diagnosis of breast cancer, they understand that they have 3 reconstructive options. One is reconstruction with an implant. Implants have been used for breast reconstruction since the 1960s. There's been a lot of concern as to whether or not implants are safe, and the answer is yes. In the right hands, with the right patient, implants can lead to a wonderful reconstruction that can last years. The second breast reconstruction option that everyone should know about is the use of autologous tissue. Autologous means your own tissue. There are 2 types of tissue when we talk about autologous tissue that we're referring to. The first is muscle. We can move muscle from the abdomen, muscle from the back, and rotate it to the chest to create a breast. The second autologous tissue that everybody always wants to get rid of and everybody always asks about is fat. We can actually use the fat from your abdomen, from your flanks, to create a breast without using your muscle. A lot of patients prefer this option, and a lot of physicians prefer this option because it's less damaging to the body. So the option of using fat alone and leaving the muscle intact is extremely important, especially for younger patients, for young women who have children who want to maintain their core, for people who exercise and use a lot of their back muscles. They may not necessarily want to use muscle for their reconstruction. So for them, if they have enough fat, autologous tissue using fat alone is a great option. The third reconstructive option is a combination of both. You can use both an implant and autologous tissue, and this is usually an option for smaller patients who don't have enough volume, patients who need a little bit of coverage on their implant so that their reconstruction looks more natural. So as I mentioned, there are 3 reconstructive options that every woman should know about.